appreciate that.
All right. Well, hey, everybody. It's great to see and hope to hear from you all. Today, this didactic is on the new Center of Excellence. And I'm going to give you an overview of what we've been asked to do, what we have agreed to do. So we are the Child and Adolescent Behavioral Health Center of Excellence. The whole Center of Excellence idea is the Department of Mental Health and Addiction Services funded program number one, but it's also a cross-system initiative of all the state departments, which I'll get into here in a quick second. So this is part of some of the bigger transitions that are going on, some of the bigger initiatives that include system of care, the Children's Services Transformation Initiatives through the Governor's Office, Family First or Family First Prevention Services Act, OhioRISE, which will be happening beginning January. The Crisis Continuum for Children and Adolescents, which I know some of our communities are already doing, but we're looking to enhance that through mobile response stabilization services. The MSY, or the multi-system youth initiatives that really are geared to modernize family and children's first councils, but also to contribute to pushing forward high fidelity wraparound and decreasing or eliminating custody relinquishment. And of course, we are also looking at our workforce, and there's lots of initiatives related to behavioral health workforce access and quality, birth to 21. So all of these initiatives are going on at the same time. And I know many of you are meeting and talking about, well, what does this mean for us? We'll continue to kind of clarify some of the things that are going on, at least through the center, so that we can begin putting out some of the training and things like that for you guys. As I just mentioned, the COE operates from a shared governance structure, and these are our cast of characters, if you will. So there's, we'll probably receive funding and or guidance from all of these folks, including JFS, Department of Medicaid, Department of Developmental Disabilities, DYS, Ohio Family and Children's First, Department of Health, Department of Education, and of course the Governor's Children's Initiative. So this is the shared governance for basically all of these projects, these initiatives that I had just shown you. And technically, the way that I look at this is we're trying to build out a system of care for youth and families in Ohio and integrate these initiatives. The one thing that I will say that I think is really refreshing about this, so I'll give you a little commentary as I go, is that this is the first time I think I've seen in the 30 some years that I've been doing this, this level of collaboration at the state level, number one, and even at the local level, as well as the first time I've seen this big a push for things like, parent peer support, youth peer support, and those things. So I think we've really crossed over into this place where we're really going to start to take statewide what some of our communities have done locally, which is build out a system of care for the state. So that's very exciting. Okay, so what are we doing? So the role of the center is to support all these transformation efforts, to build and sustain evidence-based and evidence-supported practices, assist the state and OhioRISE in the evaluation and fidelity monitoring of those services, We'll also be asked to build and sustain a comprehensive standardized assessment process that utilizes the CANs. There will be a direct service payment component of what we do for the Family First Initiative, FFPSA. And so for those youth that receive MST or FFT, multisystemic therapy or functional family therapy, that have open cases through the Department of Job and Family Services, i.e. Child Protective Services, and do not qualify for Medicaid. So those families that don't qualify for Medicaid receiving these services that have open cases, the direct service payment part for MST and FFT could be paid for through Family First and through our center. So that's a new thing. It's a new way of their looking at using 4E dollars. Assist state and OhioRISE in expanding service and care coordination capacity. And so there will be a whole thing related to these things called care management entities and their delivering of intensive care coordination, moderate care coordination. And so we'll be assisting Aetna, who is the OhioRISE vendor, and pushing out the training and the technical assistance as it relates to that. This is the quick summary of all the different functions that we will be asked to implement, including training, professional development, coaching and consultation, multiple types of technical assistance, evaluation, fidelity monitoring. There's a whole set of deliverables related to strategic business support, health information technology, and telehealth. And I'm going to go over each of these fairly quickly so you can understand what we'll be asked to do. So as far as strategic business support, there's a component of what the center is doing that will be working with provider agencies around training on billing and coding best practices, contracting, contract development and negotiation, business planning, strategic marketing, and documentation and workflow practices. So these are all terms that mean it's the business of the work. How do we do this work in a Medicaid environment, in a managed care environment, and have all of the support we need to do this efficiently and correctly, accurately. We are partnering with the Ohio Council, the Ohio Children's Alliance, PCSAO, and many of those, particularly Ohio Council and OCA, will be helping us push out that business support and training on this. That's their level, that's their area of expertise. Same for health information technology. OCA and Ohio Council will be helping with this as well. And this is all about developing capacity around health information technology, utilizing these formats to support comprehensive care coordination, and to be able to create, to help the state create strategies for electronic data exchange. This can get very complicated at the infrastructure level. So how do we talk to each other through our electronic health records? How do we share data, both with the state and with each other, so that so families don't have to tell their story over and over and over again? And so this is going to be kind of a major lift. So that will be a build out as well. We'll also be partnering with Ohio Council and OCA to provide telehealth technical assistance, and they have some training that they're going to be putting on related to that. As many of you have been aware, with the COVID all the adaptations we did with COVID, Zoom and Microsoft Teams and all of those things have come into, we've become very comfortable utilizing them. But we're also going to be turning the corner on COVID. At that point, the feds will probably, stop their relaxation of monitoring of all their confidentiality standards as it relates to telehealth. And so all of the HIPAA regulations that go into electronic conveyance of information, just like Zoom is one, will go back into effect, and each of the agencies will have to use a stricter set of security measures to use telehealth. We'll also be working with PCSAO and their Ohio Start initiative, strengthening the early childhood system. We'll be working with OKRA on that. And as I said earlier, supporting the FFPSA and OhioRISE initiatives. The main support we'll be giving are these things, which I mentioned earlier: training, technical assistance, professional development in these core service areas. So we'll be doing the training with multisystemic therapy, implementation supports. We'll be contracting with Functional Family Therapy, Inc., if you will, to do their training assistance for all the new teams. And that's really to support the FFPSA initiative, that Family First Prevention Act. We'll be supporting the intensive care coordination and moderate care coordination services utilizing high fidelity wraparound, which is part of the OhioRISE initiative. MRSS, or mobile response stabilization. We'll be also doing the training and technical assistance for that service. Ohio Start is already covered through contracts with PCSAO and JFS, so we'll just be supporting whatever they need us to do on that. Same for Healthy Families America and Parents as Teachers. Those are services that are currently initiated through the Department of Health. So we'll do some probably professional development enhancement in those areas. And of course, we'll also be implementing and training on intensive home-based treatment for the OhioRISE initiative. And this just talks about in detail which trainings will be happening. The one that I just want to mention here is there will be a slew of trainings on the CANS, the Child and Adolescent Strengths and Needs Assessment Tool. We'll be building out standardized assessors to make sure that the state has enough of them to implement FFPSA and implement OhioRISE and eligibility into OhioRISE. We'll be tiering the training so that we'll get the initial train the trainers by the Parade Foundation, who are the originators of the CANS. That will happen this summer, starting sometime in July. We're just not sure exactly when. And then we'll start pushing out the training more broadly throughout the year of fiscal year 22. So look for more information on that. It's still all being scheduled right now. We'll be continuing our learning communities around wraparound. I know many of you that are involved in the local FCFCs have participated in a lot of the work we've been doing around wraparound and in the learning communities. A lot of those things are going to continue, and they're only going to be enhanced, including coaching, consultation, and those kinds of things. Learning communities around mobile response will also continue. We're going to do a modified ECHO. We're not calling it ECHO, but we want to make what we do available around consultation to MRSS providers as well as ICC and MCC providers. So we'll be constructing that separately and Again, it's a modification. It's not true echo. We'll offer coaching and consultation on a regular basis to these services here: MST, High Fidelity Wraparound, MRSS, and all kinds of technical assistance across the board. Another part of the request for the COE is to do evaluation. So we will be partnering with OhioRISE and the state in evaluating behavioral health services in general. I know OhioRISE is going to be evaluating services at a much higher level. And so we will go in and also help out wherever they're asking that help to be given. We might help also with service costs and utilization and any kind of quality improvement initiatives related to the CANS data that we'll be receiving. There will be, as from what I know, probably a state level CANS portal that folks will be putting CANS data into, but more to come on that as we know. We'll also be conducting fidelity in each of these areas. More to come on high fidelity wraparound and MRSS. And this is all the information related to the CANS and all of the standardized assessment that will be asked to support statewide. And for those of you who have been trained in the CANS, there will be some guidelines coming out about if you're currently certified, the parameters for continuing and getting grandfathered in, maybe taking an extra training or something. But for those of you who are not currently certified, you'll have to go through the new CANS training for the new Ohio version of the comprehensive and brief versions of the CANS. I went through that lightning speed because I know I want to keep everything on time for Echo. I'm sure I can have about 5 minutes if you guys have any questions whatsoever. But look for more information from us as we push this out over the next couple of months. So you'll see a lot of communication around each of these services. The key dates to remember are Family First Prevention starts October 1st. There's some piloting going on right now for that. All the CANS training will probably start in July through August and September into the winter. OhioRISE implementation starts January 1st. And there's a lot of big lift related to that. So those are the key dates for right now, but look for us to be sending out materials related to trainings as it relates to all of these. And I will just turn it back over to Mike if there are no other questions.